Hello, thanks for listening to this video message again. It's been a really big week. The medical board has finalised its endorsement for area of practice of cosmetic surgery and has now backed this with the AMC standards for endorsed area of practice. So what this means is that there are now officially a separate set of standards for surgical training in cosmetic surgery. I think this is really unconscionable. Surgery for cosmetic purposes is identical in terms of risk factors and patient assessment to any other type of surgery. And I think that the medical board is legitimizing a separate set of standards for cosmetic surgery without any good evidence to do so. Even more worryingly, they are alluding to the need to keep cosmetic surgery markets going. And I think that's really a huge red flag. The medical board's job is to look after patient safety. It is not to think about the economy. So we're extremely unhappy with the finalization of that legitimizing of lower standards in any kind of surgery, because now the precedent has been set. It could be orthopedic surgery next, or spinal surgery, or any other type of surgery. The other major issue, which many of you have written to me about, are the guidelines that have now been fully revealed in terms of selection of patients for cosmetic surgery and management of those patients. What's really clear in those guidelines is that APRA and the medical board have grossly overreached what their remit is. It is not their job to be involved in the doctor-patient relationship. And although assessment for body image disorders and mental health problems is exceptionally important in all fields of surgery as part of understanding patients' comorbidities, it cannot be achieved by a simple administration of a standard body dysmorphic disorder form. There is no evidence at all for this approach. And it's another huge misstep of the medical board to imagine that you can fix a deficit in surgical training by administering a form. They also don't seem to have talked to anybody in the field of psychology or psychiatry about this requirement. Lastly, the issue of referrals is an exceptionally vexed one. Again, the medical board don't seem to have consulted with specialist GPs and have not at all discussed with plastic surgeons about things like a bar on specialty to specialty referrals. So it's another example of the medical board having clearly not thought through their policies. I think what's really hurtful and what's really surprising is the fact that there seems to be a systematic and unfair undervaluing and undermining of specialist surgeons. It's kind of incredible that the medical board of all people should be trying to devalue specialist surgical qualifications. And it's an outrageous infringement on our professionalism to give us a kind of recipe for how we have to see and assess patients. To lose all the clinical discretion that we use in our everyday life and that we've trained so hard to develop is really unacceptable. I've heard from many of you that these are your significant concerns for your own practices. There are other things like the advertising regulations, which I know many of you will find difficult, but that did need changing to some extent, and they seem to be less of a priority for you. The 7-day waiting period is inconvenient in terms of patient bookings, but again, it doesn't seem to be people's main priority. I think the overall tone of the way that the medical board is addressing us as specialist plastic surgeons is a major problem. So what are we doing about it? I think we have always been trying to be collaborative and constructive and joining any committees that we've been invited to through the AMC, through APRA, through facilities regulation and registries. And we've had to do that until we're clear on what exactly is being planned. And until the last 24 hours, it really wasn't clear. It now is clear, and it's absolutely crystal clear that the medical board have got it fundamentally wrong and have lost their moral compass. We therefore have to act comprehensively to protest about their behaviour. What I've been doing with the aid of ASPS counsellors, and in particular David Morgan and Mark Ashton, is having a strategy as to how we can attack this. Firstly, we have engaged a lawyer to get a legal opinion on whether this unfair treatment of our specialty is legal. We should have that information in the next 5 days. Secondly, we've approached a very senior lobbying company, Hawker Britain, and they are looking at materials and will get back to us probably by mid next week to decide whether or not they can help us and what their costings will be. Thirdly, we're strongly considering doing an open letter combined with RACs and all other specialist surgeons, because this is an area that affects not just our specialty, but many other specialist surgeons. Mark Ashton is going to facilitate that. And we had a very constructive meeting with the leadership from the Royal Australasian College of Surgeons last night. So that was with Sally Langley, John Bibiano and Chris Pike, who we've been meeting with pretty much fortnightly. We're optimistic that the College of Surgeons will get on board with that, and we're hopeful that we'll be able to get this done in a very timely manner. We're aiming to have an open letter that will hit the major media. The next strategy is that we're going to team up with other important institutions around Australia. I have a meeting with senior policy makers from the AMA. I've already met with the president twice, and that meeting is on Monday. We're hoping to get this to AMA Council for their urgent attention. I'm also meeting next week with the RAC GP leadership, because it's very clear that the GPs have not been consulted about this and are not impressed. In addition, we have a meeting with 2 federal MPs. One is Monique Ryan, who's the Teal MP, and she is a doctor and hopefully will see how important this is for all doctors. We've also had contact with Senator Ann Ruston, who's in the opposition and who's had a good relationship with Mark Ashton and I. A final thing that I think is important is to team up with colleagues who understand about proper assessment for psychological problems. And I've been fortunate enough to speak with Michelle Rossler and Roberta Honigan, who both have extensive experience in this area, and they're going to supply us with a letter expressing their concerns about the medical board's approach. So that's a lot to be getting on with, and I know that some of you have deep fears about these changes. I can tell you that there is no one more angry about this than me. It does not affect my private practice. That's absolutely true. But I feel in my heart that it's a really terrible time to see the medical board selling its soul. This is a valued institution which is supposed to stick up for patient safety and which is supposed to represent fairness for doctors, and it's failed on both counts, and we have to resist. Thank you.